Hello, it's Dr. Sheila Kilbane, and I am here with Deb Allen, our amazing integrative pharmacist. And I'm an integrative pediatrician, and we're here in our office in Charlotte, North Carolina. And we have decided to start our own little TV show to get the information out that we have been using in our office to help so many kids. And we get really amazing results with the kids that we work with and the families, because we both use our medical and Deb's pharmacy training, and we combine that with our integrative and functional medicine studies. And when we are able to combine the best of both worlds, we're able to use medications if we need, nutrition when we need, supplements, more sophisticated testing than what we were able to use when we were just in conventional practices. So we are super excited to be sharing more of what we're learning and what we're doing in our clinic so that we can help you no matter where you live. So today, we're just going to start off and tell you a little bit about ourselves and why we do what we do. And does that sound good, Deb?
I think that's a perfect place to start.
Okay. So like I said, I'm an integrative pediatrician, and I am the youngest of 5. I originally grew up in Ohio, and I was a little tomboy as a kid. I was cutting open fish, and my dad would clean the fish and then hand them to me, and I would look at their eyes and try to look at their brains. And also, while I was a kid, and I always knew that I wanted to be a physician. That was just what I'd been telling my mother this forever. And I also used to get really sick as a kid. I would get these high fevers, and I would be so sick that my mother would have to carry me to the bathroom. And after 4 or 5 days of this, she would inevitably take me into the pediatrician, who was a family practice doctor. And he was this big, bald gentleman with a thick accent, and I was scared to death of him. And I would end up getting a shot of penicillin. And if you've ever gotten a shot of penicillin, you know it's like cement going into your thigh, and it hurts like crazy. It would do the trick, and I would get better, and I would be better for many months, and then I would get another fever again. And so my mother would say to him, there must be something else going on. What else is going on? And she never got any answers. So on her own, she took me to the Cleveland Clinic, and I had some studies done, and it turns out I actually have 4 kidneys, and I have 4 ureters. So if anybody needs an extra kidney, you know where to come. And from that lesson, I couldn't articulate that until now, but getting to the root of things has always been something that has been my passion. And I'm always somebody to ask why, what are we doing? And so then fast forward to the time that I finished residency and I started practicing in general pediatrics. And I was seeing kids, recurrent ear infections, asthma that was getting worse, constipation, eczema. And these kids would come in, and I would prescribe a steroid, an antibiotic, whatever they needed. They would get better for 2 weeks, and then they would get sick again over the next 2 weeks. And sure enough, that next month they would be back in the office. And it just didn't feel right to me. And it felt like a fundamental flaw when I would be prescribing antacid medications to 2 and 3 month old babies. And sometimes we need medications, and I love that we have the medications to use, but it was far too often, and the kids weren't seeing improvements. So that's when I started. I'm a good listener, and I would listen to the moms, and they would say to me, I went off of dairy. This would be a mom who was breastfeeding, and Johnny's eczema went away, and his recurrent ear infections cleared up, or Sally's constipation resolved. And then what we also noticed is as another beneficial side effect is that their behavior leveled out. They would sleep better. They handled transitions more easily. Their allergies would go away. And we, left and right, we were getting rid of allergy medicines, decreasing asthma medications, getting rid of Miralax. And I just thought, I did this for a while without saying anything to anybody, because I thought this must be a fluke. Surely I would have learned this if this were truly happening. And then my partners would be saying to me, what's that voodoo medicine you're doing, Sheila? And then a year later, they were saying to me, okay, what are the dose of those probiotics? So it's so different than the way that we get trained in conventional medicine that it can be hard for people, and especially for physicians, to wrap their head around. And so that's part of why we're doing this little show, this TV series, because we want people to understand that this wasn't easy for us to wrap our heads around either. And Deb has an incredible story herself, and it's a lot. It's been a lot of studying. We always say we feel like we're in school every single day, because there aren't always textbooks on what we're seeing, and we're having to dig deeper and deeper as we look through what's going on. So that's why I do what I do. And then I ultimately ended up studying integrative medicine with Andrew Weil. He's that guy with the big white beard, and it was like somebody peeled the top of my head off, and all of this new information came in, and it gave me so many more tools, and I was so much more excited about being a doctor again. And that's why we love what we get to do every day here in our clinic. And so that's my story. Deb, I'd love for everybody to hear your amazing story.
Well, I feel like mine, it really started with, it was a birth because my whole life I went through pharmacy school and went right into traditional pharmacy, retail pharmacy. And I loved the families that I had the privilege of meeting during that time. It was obviously retail, and it was stressful. And but in 2004, my husband and I gave birth to preemie triplets, and so that was a huge awakening as far as me as a mother now looking at these little children and how their bodies were trying to just balance their body temperature and be able to eat and tolerate different scenarios. And so as I started trying to support the kids, it was funny because before I was pregnant, I used to make fun of women who avoided deli meat, and it was a huge transformation just for me to go to organic. And I started making my own organic food for the kids, but there was always some underlying issue that was going on with the kids, whether it be chronic constipation, or we had a speech delay, or restless legs at night, unable to sleep.
And didn't they have breathing treatments?
Yes.
I remember you talking about lining them up to do nebulizers with all three of them.
Exactly. And just having the sound of 3 nebulizer machines going in the living room. And you just take a step back. We had been to GI specialists. What I started questioning was, are we born with these deficiencies where our bodies should be dependent on these things? And so I always say that mothers do better investigation than any FBI agent ever will, and any mother out there will resonate with this. And I literally had to have a timer next to my computer in the evening so I wouldn't go off and be up all night researching. And so when I went back into pharmacy, retail pharmacy, when the kids were a little older, I had this in my head. I started to see people come in with needing acid suppressing agents, and then shortly thereafter they would have problems sleeping, or they might start having anxiety. And I started to see the digestive ripple effect of the breakdown of the systems of the body, and I started to see how they were all connected. And
I would love for you to explain that a little more. So if you were on an acid blocker, right? People
exactly.
weren't digesting their proteins.
Yes, and we have to consider if we don't have the stomach acid there to break down our food properly, not only we're not breaking down our proteins, which feed into our neurotransmitters and our fats that help make up our hormones. So, and then we have undigested food also triggering an immune response. So one of the things that overwhelmed me as a mother was actually going and seeking a allergy food sensitivity panel, because everything, all the organic foods that I was feeding them came back as sensitivities. And at that point, I knew that I had to start focusing on healing the gut and not overwhelming myself with micromanaging the pathways of our body. And that's where I come to my big aha moment, is when I'm standing in my walk-in closet looking at all of the biochemical pathways in the body and trying to figure out how I could help my daughter convert her thyroid into active thyroid hormone by feeding her more kiwi. Because
her thyroid labs were off, right?
Her thyroid labs were off, and she had high cholesterol at age 4.
Yeah.
And so it just came to me that these are miraculous pathways. Our bodies are not meant to be micromanaged. And if we look at the root of inflammation, we can start removing them piece by piece. And our patients that we work with, we see that. I tell the parents to expect it. Their physiology is going to change every week as we start working with them. And that's why we're so passionate about what we do. And we truly do learn from our patients every day. And that's why we want to ripple this outward to all of you.
Yeah. And the things that Deb figured out, and they are super healthy 13-year-olds.
Yes.
And
I'm a survivor.
They're amazing kids. And one of the huge things that one of the many things that Deb has brought to the practice is her keen understanding of that innate of gut health and the motility of the gut, and how profoundly, like, we can't, even if we're using a probiotic, that's not going to have optimal impact if our guts aren't moving. And that's why we talk a lot about digestive bitters and digestive enzymes. So it's always about getting the gut moving, about getting the bile flowing from the gallbladder, and keeping, having a daily bowel movement is our number one way to detoxify our system. So she has been an incredible partner in what we do here, and has taught me so much from what she learned on her journey and with her kids, and now every day in our practice. So we are super excited to share what we're learning with everyone, and we hope we want to hear your stories, and we would love for you to share this with other people who you think might be helped by this information.
Certainly, and we want everyone to go forward from this video knowing that any diagnosis code that you've been assigned, do not view it as something that's been written in permanent ink, because we can work backwards and we can erase those diagnosis codes if we get to the root cause of what's going on.
Exactly. And so our mission is that we want to be a voice for children, an ear for parents, and a solution for other pediatricians, because we want to be part of transforming pediatric health care. And we would love to see at least 1 million kids getting off medications they may not need. And as Deb's passion.
And my passion is to do this and know that by doing so, we're also impacting generations within families as we're removing environmental exposures, removing autoimmune issues. And we know that just from us starting this, and then from you sharing it with anyone that's out there, we can really start to make an impact, and it can just start with you.
Yep. So hop on over. Our website is SheilaKilbane.com. You can sign up for our newsletter so you're the first to receive the information that we're putting out. And we have a class online. I have a book on Amazon, and we're going to keep putting out as much information as we can to help get your child thriving again, and your family. So thanks so much.